Center for the Study of World Religions, Harvard Divinity School.
Hello, everyone, and welcome to our penultimate psychedelics event, or at least our penultimate online psychedelics event for the fall 2025 or the spring 2025 semester. My name is Jeffrey Bro, and I am a program lead here at the Center for the Psychedelics and Spirituality Initiative. Today's event on psychedelic facilitation training programs is part of the Center for the Study of World Religions Psychedelics and Spirituality series. And today's event represents an ongoing collaboration between the CSWR and Roman Palitsky and Caroline Peacock, who are both researchers and faculty at Emory University. The Center's Psychedelics and Spirituality Initiative is one node in our ongoing and evolving initiative called Transcendence and Transformation, or TNT for short. If you're interested in the Center's psychedelics programming, the TNT initiative, or any of the other research happening here at the Center, we will put a link to our homepage and our newsletter sign up in the Zoom chat function. We will also put a link to more information about the Harvard study of psychedelics in society and culture. This is a Harvard-wide initiative that includes the Center for the Study of World Religions, the Petrie-Flom Center at Harvard Law School, and the Mahindra Center at the Faculty of Arts and Sciences. It's an initiative that supports research and programming that explores the myriad ways psychedelics influence society in the past, present, and future. As one final housekeeping note, those of you who are attending today's event may be interested in our final Zoom event of the semester, which will be a symposium with the Center's postdoctoral fellows discussing sacred plant medicines in indigenous communities. That event will be online, as I mentioned, and also in person at the Center. It will be on May 12th, and we will put a registration link in the chat function as well. For today's event, we are joined by Roman Palitsky and Caroline Peacock, who will be sharing preliminary findings from their research on psychedelic facilitation training programs in the United States. This research paid particular attention to the ways that spirituality and spiritual care were addressed in these trainings. And this research is informing two new workshop offerings that will be hosted by the Center and co-organized by Roman and Caroline. Those will be launching this fall, and we will share more details about those workshops in today's event. To give a quick sense of how the conversation will unfold, in a moment I will turn the floor over to my friend and colleague Paul, who will introduce himself and Roman and Caroline. After that introduction, Roman and Caroline will both present together for about 30 minutes on their research and the upcoming workshops. And following their presentations, we will all return to center screen for a group discussion and audience question and answer. Please feel free to submit any questions you may have at any point through the Zoom Q&A tab. Though we may not have time to ask every audience question, we will share all of your comments and questions with both Roman and Caroline so that they can see the depth of inquiry their work has generated. With all of that out of the way, I will pass things over to Paul.
Thank you, Jeffrey. Hello, everyone. I'm Paul Gillis-Smith, also a program lead for psychedelics and spirituality at the Center. Without further ado, I'll introduce our two speakers today. Roman Palitsky is Assistant Professor of Psychiatry and Behavioral Sciences and Director of Research Projects in Spiritual Health at Emory University. And he is faculty in the Emory Center for Psychedelics and Spirituality. His research applies a biopsychosocial spiritual approach to improving behavioral interventions by ensuring that the treatments we offer are responsive to care seekers' cultural needs and strengths. His work in psychedelic treatment research reflects these commitments by seeking to make psychedelic therapies rigorous, effective, and accountable to the many patient populations who might benefit from them, and to support those care seekers who may experience adverse events. And Caroline Peacock is Director of Care Transformation for Emory Spiritual Health and Director of Spiritual Health for the Winship Cancer Institute of Emory University. As Director of Spiritual Health for the Winship Cancer Institute, Caroline is responsible for overseeing the provision of spiritual and emotional support to patients, families, and staff across the Winship component sites. Caroline is a certified educator with the Association for Clinical Pastoral Education, an ordained Episcopal priest, and a licensed clinical social worker. She received her Doctorate of Ministry from Emory's Candler School of Theology. Caroline and Roman, the floor is yours.
Thank you so much. So I'm going to now share our screen. And Caroline, can I see a thumbs up if this sharing is working okay? Okay, great. So yeah, thank you so much for these introductions. It's really such a delight and a privilege to be here. We've really been enjoying our collaboration with the Center for the Study of World Religions. It's really given us an opportunity to dive into an abiding interest that Caroline and I both have in both psychedelic facilitation and in training in general, and thus into psychedelic facilitation training. And more specifically, this project that I'll be sharing about gave us the opportunity to speak in depth with some of the leaders in this space and to learn from them. And we're here to share some of what we found. I also want to note we were given explicit permission to go just a little bit over, so we might go a little longer than half an hour just to prepare folks in the audience. But with that said, it's probably appropriate for us to just go ahead and dive right into the presentation because we do have a lot to talk about. So the first thing that it's probably appropriate to do is to give a kind of an overview of psychedelic facilitation, this area that we'll be talking about for the rest of today's meeting. And the first step there is probably to agree on what we mean by psychedelics. So for this case specifically, for our project, when we say psychedelics, we mean a set of compounds that produce acute, transient changes in sensation, perception, emotion, and cognition. And we're going to call these non-ordinary states of consciousness, or NOSCs, throughout our presentation. And we're specifically looking at classical psychedelics, such as psilocybin, which is the active ingredient in magic mushrooms, or LSD, as well as MDMA. Psychedelic therapies are a class of therapeutic interventions that combine a psychedelic compound with some kind of interpersonal support. And these interventions are now increasingly recognized for their potential to treat many difficult to treat mental health conditions in rather profound ways. And corresponding with that powerful positive capacity is also some capacity for risk of harm. And so facilitation is broadly recommended as a way to maximize the benefits in psychedelic treatments, but also to mitigate or reduce potential harms. So when we say psychedelic facilitation, who are we really talking about as psychedelic facilitators? There's just a small word cloud to the top right on the screen, representing some of the terms that get used, definitely not a comprehensive list. And these terms really are used purposively, depending on the context. Clinicians, observers, sitters, monitors, guide. We use facilitator as a broad term that tends to be encompassing. And psychedelic facilitation, when we say that, we mean the accompaniment of a person who's taking psychedelics, broadly speaking. Now, there are some much more specific guidelines and standards. So, for example, per the FDA, which is really has a huge influence on how we think about facilitation, because much of the research that we use to understand how psychedelic therapies affect people with mental health concerns, a lot of that research comes out of clinical trials, which are beholden to standards that are not exclusively, but also set by the FDA. The FDA issued a set of recommendations about who can be a facilitator or a monitor in a trial. And it's important to remember the context of what the FDA is looking for, which is maybe slightly different from what we think of in psychedelic facilitation. And there's really two priorities. One is safety, right? So they have a strong interest in ensuring the safety of participants and future patients. And the second is clarity of the science. And a lot of that is in the context of randomized controlled trials with blinding. And maybe that explains some of why we get these criteria or recommendations from the FDA, which is if you're running a trial, they recommend justifying why you would even include a psychotherapy component, because of course having psychotherapy in there can muddy up the scientific results. And the second aspect that they emphasize is it's preferable that the in-session monitor is not involved in the post-session psychotherapy, again, because the monitor, they'll probably be able to tell whether the participant was exposed to the active compound or to a placebo, and that could, again, muddy up the results with expectancy effects of different kinds. And so again, just recognizing the difference in the worlds of what some might be thinking of in terms of facilitation and the standards and recommendations that we have. So per these recommendations, it's recommended that there be a lead and a second monitor, so 2 monitors, and examples of qualifications for lead monitors all include some kind of clinical licensure. And these would be clinical or counseling psychologist, psychiatrist, MSW, and so on. But note that none of these are clergy, none of these are chaplains. Now, this is not an exhaustive list, and there have been some very strong arguments for why chaplains or clergy might be considered also as eligible to provide facilitation. But behind all of these debates is maybe a bigger question of, should we be considering these as psychotherapies at all? Do we need facilitation? To my knowledge, only one trial has attempted to do psychedelic therapy without any facilitation. But the debate has really been put well by Goodwin and colleagues' paper, Must psilocybin always assist psychotherapy, where they really do ask this. I think it's a provocative question for all of us. Would it be better if you, let's say, on Saturday, you take your psychedelic pill, it's supposed to get rid of your depression, and you take it and you don't need any support, you go to sleep and you wake up and you're feeling all better. That's really the way that many of our therapies currently work. And yet, the majority of recommendations, overwhelmingly, we find that facilitation is the gold standard for therapeutic care with psychedelics. And to facilitation are attributed improved outcomes when taking psychedelics, reduction or mitigation of potential harms, better monitoring of safety and adverse effects, better monitoring of set and setting, both through preparation and through the expertise of a facilitator, improved access to care for people who are not sure how to acquire the benefits of psychedelic treatments, and also better coordination with the continuum of care that we find in the community. And I couldn't resist sharing some findings from an ongoing study of ours. So we actually polled, this is from about 800 Jewish participants who have taken psychedelics. This is in our Jewish Journey study. And these are box plots of preferences for how you would like to take psychedelics. So it's a 1 to 7 scale, and this shows the distribution where you see just overwhelmingly, people would prefer to take psychedelics or the capacity to take psychedelics with a facilitator or guide, and that there is actually quite a strong preference for taking psychedelics with a spiritual teacher or guide. The midpoint of the scale is at 3.5, just for reference. So all of these, the centrality of these distributions is above the midpoint. And also this is higher than a mental health clinician. So in light of this, a question that we often get and that I'm sure many people here have received is, well, how the heck do I become a facilitator? And if you look into it, there's actually quite an emerging landscape developing for different kinds of trainings, for different circumstances that put people on the path towards psychedelic facilitation. Our task was not to replicate or make redundant any of the resources that are currently available. There's really been excellent work from Blossom Analysis, psychedelic courses, Psychedelic Alpha, and Brain Futures, and I really encourage folks to look these up for sort of a broad databases on psychedelic courses that are available. But if you look at all of these, what you'll find is that the structures, the requirements, and the professional applications for training really vary quite a bit, both from state to state, also from country to country, and from program to program especially. We see that the goals of preparation are quite diverse. Some programs focus on preparing facilitators specifically for that clinical trial context that I highlighted earlier. Some really focus on harm reduction, mitigating potential risks, just giving people the tools to use psychedelics safely and responsibly. Some are really focused on psychotherapy that uses psychedelic compounds. Some focus on psychoeducation, just giving people as much information as they need if they're going to use psychedelics. Of course, we know there is a robust underground practice that has preceded the current wave of psychedelics research. And so there's decades of history and experience in training underground psychedelic facilitators outside of legal contexts. And increasingly, there is a focus on training facilitators who would be ready to work to serve in service centers, for example, in Oregon for psilocybin service centers. And at the same time, the opportunities to apply one's training, once you've gotten that training, really depend on federal and state standards as well as resources. So basically, you can go through the best program you can find, get that training, and then it's not really clear how that training will ultimately translate into a career or a vocation as a psychedelic facilitator. So returning now to our overall kind of overview of psychedelic facilitation, there's an important component that I haven't mentioned yet, and that is the spiritual care dimension of psychedelic facilitation. So we know that there are well-documented impacts on spiritual, existential, religious, and theological dimensions of people's lives. We're abbreviating it as CERT, spiritual, existential, religious, and theological, from taking psychedelics. These impacts are often attributed a great deal of importance by study participants and by people in the community, and this importance can last for many years after that experience. And so when we think of attending to spiritual, existential, religious, and theological issues in psychedelic care or CERT, one of the things that we did 2 years ago in a paper that we published was just to outline that really CERT is not something that is extrinsic to participants. For many of the people who take psychedelics, many of our care seekers, spirituality is part of their individual, social, and collective well-being. And so with a compound like a psychedelic compound, with an intervention that really tends to provoke the potential for CERT experiences, it's important to address such experiences capably and competently when they arise. The other issue that we highlighted is this little triangle figure in the bottom left corner, which describes a hypothesis. Now, this hypothesis, we don't have enough data to either confirm nor discard it, but it is increasingly kind of a testable hypothesis that CERT impacts may play a therapeutic role in the effects of psychedelics. And what we do see is a growing number of studies that document a kind of a dose-response relationship between the dose of a psychedelic that people take on one hand and the magnitude of the CERT impacts that people experience on the other. And also, there is a growing collection of studies that seems to document a similar relationship between how much of a certain impact a person had and the benefits that they attribute to the psychedelic treatment that they received. And so, again, this looks like a mediation then, which means that CERT might be on the pathway to enhanced or improved outcomes after taking a psychedelic. And if that's the case, we really want to be able to address it in care when it shows up. So the meaning of this for facilitation is that facilitators should be capable of addressing spiritual needs if they arise among clients or patients. They should be equipped to address or mitigate the risk of imposition or spiritual coercion. They should provide high quality, responsive care according to existing standards in mental health treatment and in consistency with current evidence-based practice. So taking all of that together, what our project sought to do is to build on the already existing breadth-oriented work that I referenced earlier in the existing online databases that showcases the variety of the trainings available, and to complement that breadth with some depth, diving into personal conversations through a series of interviews with established and emerging leaders in psychedelic facilitation training. And what we really wanted to explore in the discussion that we're having today is some of the emphases and norms that our interviewees talked about, that the programs valued, the gaps that they identified in the field of psychedelic facilitation training, and some of the gaps that emerged when we started to look at all the content that they were giving us, and some of the needs in this space that it might be possible to address with the resources that are currently available. And throughout all of this, of course, we had this focus on CERT responsive care, addressing spiritual, existential, religious, and theological issues, and training facilitators to be able to do so. So our approach really took the form of a listening tour. We spoke with established experts in training. We spoke with multiple programs that were in transition, changing and adapting to a shifting landscape and environment, and we wanted to take that into account in the results that we'll report. We also spoke to some emerging programs that were trying to figure out how to make it in this landscape. I want to emphasize this is not a survey, right? We did not take kind of a comprehensive, exhausted measurements of every little thing that programs do. Instead, we really wanted to focus on what it is that psychedelic facilitation programs thought were important. What did they most value or most want to prioritize in what they do? We included programs that focused on macrodosing, so we didn't talk to programs that were more oriented toward microdosing. Again, classic psychedelics and MDMA, but not ketamine, because ketamine is kind of its own ecosystem right now. With considerable overlap with standard psychedelic training, like what we're talking about as well. We wanted to talk to programs that trained facilitators specifically, not generalist psychedelic education programs, and programs that provided their training in an interactive way. So programs that worked with trainees rather than open access or open source learning management systems. We were also trying to focus specifically on the US. I do want to note the context of this project became important while we were doing it. Our interviews occurred between last December and just this past March. So this is very much still a work in progress, but also just we noticed as we were talking to different programs that they were actively responding to ongoing changes in the environment, changes to the funding landscape, changes to the training landscape right now. So there are, we heard from multiple programs, and I'll mention this, that there might be some, oversaturation in the market. The recent FDA decision about not rescheduling MDMA has had a major impact on training. And there's been a new federal administration, and that has had profound impacts on both healthcare and education, and programs are also adjusting to those. So just an important note about that context that we didn't want to ignore. So I'll turn it over to Caroline for just an overview of the programs that we spoke with.
I think you're muted, Caroline.
Thank you. Sorry about that. Thanks, Roman. So you can see over to the right of the slide several of the programs that we were able to have really in-depth and wonderful conversations with. We had 13 conversations so far with programs, and we want to emphasize that because it may be that people are listening who are representing programs who would be interested in having a conversation with us and sharing with us what's happening in your program. And there's we can certainly make time for that to still happen. So please reach out to us if that is something that you're interested in. 68% of conversations were completed of the folks that we reached out to. Some people we didn't hear back from, and some people, when we started a conversation, we discovered the scope of their program didn't quite meet what our project was focused on. There was a wide variety of programs in terms of the cohort size, as small as 5 people in a cohort to over 100. And we had a variety of programs in terms of being university affiliated, industry sponsored, independent programs, for-profit and nonprofit. Some programs had more than 10 years of experience, and some were very new. There were both certificate and non-certificate programs. There was module-based education as well as full curriculum programs. And there were also programs that were offering training specifically to teams who are working in a clinical trial context. Next slide, thank you. And in terms of the compounds, some of the programs were really focused on just one compound, while some were working with several compounds or any psychedelics. In terms of certification for the Oregon and Colorado programs, those were the ones that several of those offered a certificate, and there were a minority of programs that offered no certificate. And there were programs where their certifications depended on local rules. So, for example, they would be training folks and saying, whatever training we're providing, you will apply these skills based on particular legal frameworks where you will be facilitating. Most of the programs that we had conversations with had a combination of online and in-person training, and the time commitment was very, very varied. So as short as 1 week to multi-year programs.
So
and I will pass it back over to Roman.
Thanks, Caroline. So we'll present the findings of all of these different conversations in a kind of in a set of categories that we really wanted to pull out for this presentation today. The first is going to concern the priorities and practices of these training programs. So a lot of this is about a question that animated us was, what do these different programs believe that it's important to teach their trainees? And that was broken up into content. What kind of content did they find it important to deliver? Training in therapeutic practices. So are they teaching any therapeutic practices? And if so, what are these therapy practices? And how are they addressing spiritual care in their pedagogy? We then will zoom out a little bit to highlight the training values that seemed to kind of be a through line across the programs that we spoke with. So what are the values that they found most important? And these values we're going to translate into the gaps that we observed. So given what these programs thought was important, what gaps emerged in meeting those values and living up to them? And from there, we will discuss the opportunities that we see, specifically with regard to cert responsive training and meeting those gaps, and the next steps that we're going to take. So Caroline will talk about the priorities and practices first for who's in the program.
Thank you. So our faculty and trainee qualifications, I'm going to talk a little bit about those. So our the faculty in the training programs were quite diverse, and they were typically highly qualified. So, and they tended to fall into two categories. There was the who category and the what category. So for some programs, the identity of the faculty was very important. They were known leaders in the field with very positive reputations, tradition holders, people who represented identities from sciences, indigenous backgrounds, etc. And then there were folks who fell more into the what category, and there was more standardized criteria. So they were looking for specific qualifications to teach. For example, persons with particular licensure, persons with very specific facilitation and teaching experience, content experts, or they were specifically looking for tradition holders. And then in terms of the trainees, they were also quite diverse. So some programs were welcoming very specifically established clinicians, people with licenses like PhDs, PsyDs, MDs, LCSW, et cetera. Whereas other programs, such as the Oregon-based programs, they were based on the state requirements, and the basic state requirement is for a person to have a high school diploma. So there were some programs where there was a broad range of persons who were in their cohort, someone maybe with a high school diploma and then someone with advanced schooling. And multiple programs built competency. They expected competency upon entry into their training model. So they might expect people to be already skilled therapists within their discipline or already experienced in psychedelic facilitation. And programs were also often looking for personal characteristics. So within their interview processes, they were screening for relational competence, as an example. They had methods in their interview process to try and gather information about those types of personal characteristics.
So what did these programs want to teach their trainees? The first part of what we'll talk about is just the content emphases that programs valued. First of all, basically every program that we talked to acknowledged this now pretty widely acknowledged cycle in psychedelic treatments. And it's a process that goes from screening through preparation, through a dosing session, through integration. And so the skills and content emphases that they talked about were often related to these components. So a screening might rely on knowing what the contraindications for psychedelic therapy are, knowing how to talk about informed consent, knowing how to provide education to a potential client about what a psychedelic session might involve. Preparation involves some meetings with your facilitator, one or more, that would prepare the client for the dosing session that they're anticipating. And so again, psychoeducation shows up there, but also information about how to set up the space, also setting up the client in order to best benefit from the session. The dosing session probably garnered the most content information in our various conversations. And a lot of the content focused on different aspects of making sure that the dosing session went well and safely for the client. So that includes music, capacity to hold space for someone else who is experiencing a non-ordinary state of consciousness, therapeutic use of touch, knowing what to do in an emergency situation. And the integration component would typically involve a meeting or meetings after the dosing session where the client is set up to benefit and to continue to move forward in their lives after their dosing session. Also, that is often when they would speak about consultation or referral in the treatment in the facilitation process. So, so those are kind of these arch emphases that we found recurrently, and some of the practices that that programs talked about. But also, there was an important set of content areas that concerned what I would call book learning, right? So information that was important to impart to trainees. These include basic principles of psychopharmacology. It doesn't mean that programs are training their trainees in how to be pharmacologists or in pharmacodynamics or pharmacokinetics, but they wanted trainees to be conversant to some extent in these topics. Some of the history of psychedelics, and this can be interpreted broadly. Some programs focused on history of psychedelics from a long historical, sort of a deep time perspective that includes long histories of indigenous use and practice, and some were more constrained. Ethics was an emphasis. It's in this category, the sort of book learning category, but I want to emphasize that most programs we spoke with did not think of ethics as only book learning. They really wove ethics into just about all parts of the training. They wanted their trainees to have research literacy, to know how to interpret and use the latest research findings, principles of safety, again, knowing how to prevent and detect adverse events that are known to the programs, a good vocabulary in non-ordinary states. Again, not only book learning, some of this was also an aspect of experiential learning for these programs. Programs also focused on principles of reciprocity. For multiple programs that we spoke with, this was an explicit focus in their teaching, and also diversity, equity, inclusion, and justice. Every program that we spoke with described the importance of DEIJ, although not every program had an explicit kind of a format for teaching these principles. And then there is another sort of set of skills that programs emphasized, and these are kind of the relational, the active skills that are not specific to any phase of psychedelic treatment, but that are useful throughout the psychedelic facilitation as a whole. And these concern generalist relational skills, how to have a good relational style, relational capacity with a client or patient. How to support participants' autonomy. And this overlaps, of course, with issues like informed consent and holding space and use of touch. A few programs talked about cultivating a therapeutic presence. Again, this really will depend whether the program thinks of itself as training therapists, and multiple programs, especially ones that might focus specifically on, let's say, the Oregon guidelines, which do not emphasize psychotherapy at all. They would not necessarily call this a therapeutic presence, but some kind of a presence that is supportive and helpful to the client. Cultural humility was emphasized as well as a practice. Reflexivity. So we heard often people saying, well, you really need to be doing your own work. You really need to be able to examine and also have other people show you sort of places where you might have gaps that you would need to address. And just an overarching emphasis on non-directive approaches, which we'll talk about more in just a little bit. How did these programs teach all of these different skills? So this was a question that we asked all of our programs. We know that these are important areas to cultivate. How are you managing to impart these skills? This is a lot of different topics to your trainees. And so we learned that programs use a range of different strategies. All the programs that we talked to have some sort of a small group component. Some programs are small by default, and so they do not use large groups, but many, the ones that had large cohorts, also used large groups. Many programs, but not all, used dyadic learning, both in terms of a role play, but also pairing people up to learn. And all the programs had some sort of an independent learning component. They presented content through didactics, through providing opportunities for observation, both through watching videos of psychedelic facilitation done well, and also psychedelic facilitation done poorly or even transgressively, to learn what not to do. And considerable opportunities for discussion, especially in small groups and dyads. There was also a major emphasis on practice. So every program that we talked to discussed how valuable it is for trainees to have some kind of a practical component to their training. So every program that we talked to did describe role plays as one of the ways of enacting or practicing what trainees were learning. All of the other ones with asterisks were not universal and really dependent on opportunities. So many of the programs used retreats, but not all of them. And retreats were typically ranging from a weekend or a long weekend to a full week of coming to a retreat. Sometimes that would involve entering a non-ordinary state oneself. Practicum hours, and practicum hours are, again, especially important for the new credentialing requirements. So a number of programs required practicum hours. Self-experience, a number of programs talked about how valuable it is for future psychedelic facilitators to have their own experience of a non-ordinary state of consciousness, and especially connected to a psychedelic or something like a psychedelic. So some programs did offer self-experience. This is not always possible, and some programs use techniques like holotropic breathwork to make this happen. And finally, modeling. This is something that was a little bit of a surprise, but is actually really important now that we look at it. And an example of this was we spoke to a program that talked about, well, how can you teach boundaries to trainees in a 200-hour program? This is a very complicated topic. And so in addition to giving guidelines and doing role plays, we try to model appropriate boundaries in the way that we teach and the way that we set up the program. And I thought that that was very valuable and good to acknowledge as well. But overarchingly, something that was repeated by multiple programs was this reliance on the prior background of the trainees. So, when asked, how do you cultivate this kind of rich relational competency or clinical skills in really what is quite a short amount of time? Most of these programs last less than a year. The answer we got a lot was, well, we only really try to recruit trainees who already have established prior backgrounds, people who are established in their own clinical discipline, who already know how to provide therapeutic care, how to deal with boundaries, how to deal with various kinds of unusual or emergency situations. And then we build on that background, and that is how we establish those competencies. So the next part of this talk will really dive a little bit more into that therapeutic training. The questions that animated the therapeutic training part of our project for us are, for psychedelic programs, is psychedelic facilitation considered therapy? Can therapeutics be taught in psychedelic training, and should therapeutics be taught in psychedelic training? If we're not thinking of our facilitation program as teaching to a therapeutic standard, maybe we shouldn't say that we're teaching therapy. But if we are, finally, which therapy approaches should we teach? And there were some very common threads, and I'll highlight these here. Most programs, not all, but most, talked about these elements. So some kind of a non-directive approach to treatment, to therapy. Sometimes this can be, we can see this as discussed as a sort of an inner healing intelligence or an inner healer. Sometimes in other terms, just letting the medicine work, or letting the person's process take its own form. People talked about common factors approaches from psychotherapy, which is just these sort of common principles of providing empathy, positive regard, and being straightforward and honest and transparent with your client, which we also think of as Rogerian therapy principles. Our programs talked about harm reduction as an important set of principles to embody in the training of facilitators. And we saw this set and setting approach recurrently. So really setting up participants to learn how to accommodate for the mindset of the client and the setting that they're creating for the client. There also are some honorable mentions that we'd like to make. So Stanislav Grof's work in psychedelics and in transpersonal psychology seems to have had a considerable impact, and multiple programs talked about influences from Stan Grof, especially when people talked about sort of the framework of a spiritual emergency or a spiritual emergence to deal with difficulties in psychedelic sessions. Jungian principles made several appearances, and several programs talked about internal family systems as a therapy approach that they drew upon. We also wanted to acknowledge some notable influences in how people are thinking about therapeutics. Again, Stan Grof's work was considerable. There's also been a lot of very detailed pioneering work by Janice Phelps, who works with CIIS right now. Multiple programs acknowledged Janice Phelps's influence on this field and really drew upon that work. Multiple programs acknowledged the establishment of underground practice already and its influence on training potential, and the role of indigenous perspectives. But probably more than anything, programs talked about being able to teach in a way that was conversant with credentialing standards in Colorado and Oregon. So now I'd like to focus on cert issues in psychedelic facilitation and what we picked up on there. So among the programs that we spoke with, the most common approach to CERT was not really any dedicated content. So rather than an explicit module or a curriculum, we instead saw kind of CERT addressed as a part of cultural competence or cultural humility more broadly, which might be a very appropriate way of dealing with CERT issues. Many psychologists and psychotherapists deal with CERT issues in the same way. There was also a kind of sometimes an ambivalence towards spirituality and whether we, as a facilitation program, should really be teaching about spirituality or whether that's maybe a little bit outside of our lane. And considerably more ambivalence about, I underline the R, religion with a capital R in this space. And approaches that were discussed included some of the ones that I mentioned earlier. So transpersonal psychology was used to talk about spirituality, issues of spiritual emergence, Jungian psychology. Some programs talked about mindfulness as a way of helping their facilitator trainees navigate the spirituality of their clients. We saw a recommendation for a program or for a facilitator to ally with a specific spiritual community that seemed to be doing a good job of it and to learn from them. Some programs did talk about spirituality as a way of knowing and as an explicit focus, much like scientific knowing. There was an emphasis on exposure to other trainees with different spiritual and religious perspective as a way of absorbing or taking into account the variety and diversity of spiritual perspectives. Multiple programs talked about a mystical experience framework, which we see a lot in the psychedelics literature more broadly. And sometimes we heard when we asked about dealing with adverse experiences or challenges, we also heard a kind of a spiritual opportunity as the narrative for adverse experiences. So zooming back out from these specific content areas, I just want to briefly highlight a set of training values that we identified in our programs and the movement from values to the gaps that we identified. So I don't think I'm going to speak in great detail about all of these, but I'll just name one from each of these. So first, in terms of safety, and just because our focus is on CERT, I think a lot of the response when we asked about CERT issues and CERT safety was, on one hand, concern about religious imposition, but also just not really, the scientific research is not really caught up to being able to describe explicitly what the safety issues are in terms of spiritual struggle and spiritual difficulties. Um, uh, the availability of parity with credentialing bodies like those in Oregon and Colorado, as well as international parity, was very important. But also there is this gap, right, that we spoke about earlier, sort of a bottleneck in work opportunities. Once you've been trained, how do you apply that training if there are not enough service centers compared to the number of facilitation programs that exist? There was a strong focus on diversity, equity, inclusion, and justice, but approaches were very highly varied. And so there was perhaps some uncertainty about what is the best standard for teaching about these topics. One issue I'd like to highlight, programs talked about accessibility as being a key value. But one program mentioned, is scaling up always good? We always talk about wanting to scale up, but can you teach good, high quality psychedelic facilitation at scale? And this issue of, are we and should we be teaching clinical and interpersonal competence? Multiple programs just decide, we're going to say we're not teaching therapy skills. That's not what we're doing. And yet a question that emerges then is, okay, well, we're saying we're not teaching therapy skills, but the trainees who are enrolling into our program, it feels like that's still what they sort of expect to get. They still come in expecting to get some kind of therapy training. And just an overarching need for further ethics training and ethics models and more explicit ethics models for psychedelics. With regard to CERT competence, again, we found this sort of ambivalence about CERT. Some programs really preferring to avoid these issues, some treating it as cultural competence, but some programs really focusing and saying, we are going to teach a very specific spiritual approach. The credentialing standards do not account for CERT a lot of the time, and so it can get left out. There's a reliance on very specific lineages or models at times. And I don't mean to be picking on transpersonal psychology. It can be a very useful approach. But if that is the only approach to dealing with spiritual, existential, religious, and theological issues, we may need to broaden our vocabulary a little bit as well. There is really, we thought, an interest in engaging with CERT competent training standards from other disciplines. So from psychotherapy or from chaplaincy, disciplines that already have good standards. Programs acknowledge that there's really a great need for more experiential learning, more hours spent learning, and that's what I'll focus on there. So taking all of this together, we wanted to look at for opportunities to provide CERT responsive care training. And we thought that it would be important or advantageous to draw on disciplines that already have highly developed ethical standards, that already are paying a tremendous amount of attention to non-imposition, to autonomy, and to pluralistic standards of care, that have existing research bases, and that have well-developed pedagogical standards for teaching CERT responsive care. And disciplines that are suited to non-ordinary states of consciousness, to working in clinical contexts and working with vulnerable populations, and that have some translation potential for psychedelic care. And so the disciplines that we highlighted for these opportunities include the discipline of healthcare chaplaincy, and also the well-developed work on spiritually integrated psychotherapies that has emerged over the last several decades, with considerable potential for integration with psychedelic facilitation. So now, toward the end of our presentation, We'll just highlight some of the next steps that this all leads to. We want to be able to digest all of this learning and share it in a white paper available to all. So look out for that from the Center for the Study of World Religions soon. And we also have been working on curated training opportunities that focus on spiritual care. And I'll turn it over to Caroline to describe these.
So we're really excited that the Center for the Study of World Religions this coming fall will be offering 2 weekend workshops. The first workshop will be September 19th through the 21st, and the topic will be spiritual, existential, religious, and theological aspects of psychedelic care in clinical settings. And then the second workshop will be in December, the 5th through the 7th, the same topic, but the focus will be on community-based settings. It's really important to emphasize that these trainings are not going to be like those multi-month psychedelic facilitation training programs that are very comprehensive. Rather, this is going to be very focused on these CERT elements for persons who are really interested in diving into those pieces of content. Our curriculum is in development, and the training will be both didactic and experiential. And we're going to give you a little bit of a view of what some of the workshops may be. Next slide, please. So for the September workshop, some of our tentative topics are going to be overview of CERT in psychedelic facilitation and chaplaincy approaches to CERT, overview of spiritual health practitioner competencies in psychedelic facilitation, what it is to hold space, both offering didactic information about that as well as practice to participants. We're going to provide opportunities for chaplains to learn about what it is to work with other healthcare professionals, some skills for working with other disciplines. And then on the flip side, helping healthcare professionals work with chaplains, what's important for other disciplines to know. We're going to draw on evidence-based spiritually integrated therapy models for some of our content. We'll have a workshop on power dynamics in psychedelic facilitation, as well as on working with non-ordinary states of consciousness. We'll have a workshop on broadening the biomedical perspective, and we will also discuss some of the clinical applications of where chaplains are working in psychedelic spaces, such as in ketamine-assisted therapy, in clinical trials, and palliative care. We also think it's really important to talk about advocacy for CERT in psychedelic facilitation and advocacy for chaplain participation in this type of work. So we'll be focusing on, we'll offer a workshop on what the role of advocacy is. And then looking to our December workshop, we have some other topics. Our tentative topics are CERT overview in psychedelic care, chaplaincy approaches to CERT, highlights from novel psychedelic, spiritual psychedelic communities, what CERT elements look like in retreat settings. We're also going to have a workshop on working from within our lane, what non-imposition of spiritual frameworks looks like in retreat settings. We'll explore ethical considerations in communal spiritual practices. We'll take a look at the legal landscape of religiously based psychedelic practice in the US. And we're hoping to explore art as a spiritual practice in communal settings where psychedelic facilitation is happening. We will look at spiritual assessment and tending in group settings, which is something that is often taught in chaplaincy spaces. And also, we will explore the topics of allowing and containment as spiritual practice within group settings. So now we'll talk a little bit about the application process. So for the September workshop, the application is going to go live in early May and it will close in June. And for the December workshop focusing on communal context, they'll go live in July and close in September. The application will be on the CSWR website and also in the newsletter. Workshops will be free. which is we're really excited about. However, travel and accommodation are not included. Participation in the workshops will be limited, and the application will invite applicants to include professional and biographical information, as well as written responses to various prompts about motivation. So we welcome, especially for our September workshop, we welcome applications from people from a broad variety of backgrounds in terms of those clinical contexts. And we are really delighted to be sharing this information with you about our project. And if you have any questions for us, you can reach out to either one of us. And our emails are right there. So I think we're going to pass it back over to Jeff and Paul to facilitate the Q&A section.
Wonderful. Thank you so much, Roman and Caroline. This was fantastic. It's great to see all of the results from these many conversations, and I'm very excited about both of these workshops. For everybody out in the audience, please feel free to add questions you may have for Roman and Caroline into the Zoom Q&A. We have about a half an hour for those, and so would love to see what's on everybody's minds. To sort of kick things off with a question about the clinical versus sort of a community setting. I love that framing is how these workshops that are coming out in the fall are structured, and especially as somebody interested in the psychedelic church space, feel like that community-based and religious setting is so important to have training for. And I'm curious if in the course of your research working with these different facilitation programs, if there was an emphasis on non-clinical facilitation and religious facilitation or spiritual settings, and if so, how that was approached or handled by the folks you were talking to.
This is a nice opportunity to go into. I was so nervous about going over time to go into a little bit more depth. So this came up, I think, in a couple of ways. One is several programs that we talked to actually acknowledged that, like, we keep talking about these service center standards or these credentialing body standards or clinical trials. And it's important to remember that, we haven't yet decided the question of whether these are primarily meant to be biomedical interventions, right? And we're sort of we're skipping over that and saying let's all be clinical, let's all wear white coats. And so some of the programs really emphasized a very different approach, and that was much more community centered, much more preparing folks to work with clients and patients outside of a treatment center, outside of a service center or clinical trial space. That also comes with some liability issues, maybe put broadly, right? So and so those programs also, I think, are some of the ones that are doing education about what are the boundaries that facilitators need to walk in terms of, not getting into trouble around, on one hand, helping somebody with harm reduction or helping them navigate sort of their own kind of journey outside of a clinical space, but also not being in a liable situation where now you're sort of, it's on you if something happens.
I had a question that formulated during your presentation, and then somebody else in our audience asked a very similar question. So I feel either one of us is onto something. The way they worded their question is, what role does prior psychedelic experience or expertise of therapist trainee play in programs? This prior psychedelic experience and prior psychedelic facilitation is the piece I was particularly curious about. How is the ask framed for prior experience in psychedelic facilitation, given the dearth of above ground opportunities for that?
Yeah, I think that this is a really good question. And I think different programs had different ways of approaching this. Some programs explicitly asked and explicitly wanted people to have experience. And other programs, maybe perhaps some of the larger programs um, didn't ask quite in the same way. Several of the programs really encourage some kind of experiential component, although that was most often achieved through something like holotropic breath work. But there was not, I wouldn't say that there was a consistent approach to expectations around prior psychedelic experience. I'm not sure, Roman, if you would agree with that.
Yeah, no, and I think, this wasn't anything like a full-on generalizable study, but at least for me, I detected also some important kind of cultural currents, right? So there are folks that we talked to who I think for good reason. I don't really want to put my thumb on any scales in this conversation, but they had good rationale for saying that personal experience with a psychedelic was important for a good facilitator, and even included that as sort of one of the things that they valued highly in their screening of trainees. And others just really didn't want to. They said, listen, there's we're, for example, working with clinical trialists, and we want people to be able to support safety. That's not something that we're very concerned about. Yeah. But I think in general, there was acknowledgement that competence with non-ordinary states is very important. Yeah.
And that those non-ordinary states are translatable across the technology or technique to manifest them.
Not necessarily. I don't think that I didn't get an impression one way or the other. That's a really important and very specific question. But I didn't get personally, I didn't get an impression one way or the other about whether, let's say, having a near-death experience or having just another profoundly altered state would give you some kind of lexicon for managing somebody else's trip.
And on this question of the importance of altered states, I'm curious both for you, Roman, working in the clinical psychotherapeutic space, and then also Caroline, for you working in the chaplaincy space. How does what you were seeing in these psychedelic facilitation training programs and their emphasis on the importance of having altered states compare with either in similarity or differences to what you see in your professional spaces and how they think about the importance of altered states experience?
Caroline, yeah, I can start. Because I know that in chaplaincy specifically, this is a very important issue. So I'd love to hear from Caroline too. But at least in my discipline, I think where what I refer to a lot is questions about own experience with psychopathology for a good clinician, a good psychotherapist. And I think you find two really important narratives that have to be held in tension. One is, one does not need to have been depressed or have had schizophrenia or have had experience of bipolar disorder or complex grief in order to provide skillful care to somebody who is experiencing that. You need to have skill, and you need to care about the other person. And the other equally, I think, important narrative is that lived experience of psychopathology really matters for the kind of care that we provide, and being porous as a discipline to that lived experience is really vital. So I think both of those are the analogies that I turn to in my field. I'm curious, Caroline, what you think.
Well, in chaplaincy education, there's a really strong emphasis on exploration of personal experience. And sometimes we use this phrase self-literacy. So exploration of the self as within CPE, it's called the living human document, so somebody can actually study themselves to kind of understand their inner workings as they're engaging with another human being. And so whether that experience is with, in a chaplaincy context, whether that's with having some kind of medical condition that you might see in a patient in a hospital or in a psychedelic context having personal experience with psychedelics. I think there, within the chaplaincy type education, there's a strong emphasis on exploring what a person's motivations are for doing the work and kind of what's coming up for them in the moment in order to mitigate against imposing personal perspective. So the personal perspective may be extremely helpful if somebody has a similar experience, but there's also a risk of over emphasizing sameness with another person that you might be accompanying, because their experience may be extremely different from what one's own experience is. I'm not sure if I'm getting to that question, Jeff.
That's great. Yeah.
I am there. I have never seen a more lively Q&A for one of these events, which is delightful, and I appreciate our audience's engagement this evening. This question really struck me. Of the organizations that you surveyed, how many of them train students on group facilitation, as opposed to the more Western mode of one or two facilitators working with a single client? I know you mentioned that that's sort of the standard mode. And then of them, if any, how many emphasize learning from rather than appropriating from established indigenous practices? And this is an interesting note I think worth including. I ask these questions because in the psychedelic underground, psychedelic use within small groups is not rare.
I could not give you the exact number right now. I would have to go into our notes specifically, but a handful. I would say a notable minority. Does that comport with your experience, Caroline? So a non-trivial minority did take that into account and did include focus on group work. Some really prioritized, a very small number really prioritized group work. The appropriation versus learning from issue, I think just in the last couple of years, I've noticed a lot of change in how people talk about this, and I think just about all the people we spoke with really kind of acknowledge that there is this important edge between appropriative work and behavior, and on one hand, kind of reciprocity and an exchange, and on the other hand, acknowledging like, probably for a host of different reasons. One is that, I mean, we don't live in a traditional community. We're different in many different ways, and just because a practice is ancient does not mean that we need to use everything that practice has. But also just being transparent and sort of being inspired, but then sort of moving in one's own direction and being kind of transparent about one's own cultural background. Yeah. Caroline, did you want to add anything to that?
I think that's a really great response.
Another question from the chat. This person's wondering about what extent you saw programs evaluating themselves, and if you did notice that internal evaluation, what sorts of themes were they looking at when doing self-evaluation?
I can talk about this. So this was one of the values, and sort of a number of programs talked about this as a need in the space. I would say kind of a small handful described active self-evaluation practices. It doesn't. So again, I just want to remind the audience, this was not an exhaustive survey. So if we gave everybody a questionnaire and said, do you do self-evaluation? Everybody might have said yes, but instead we asked people, what do you think is most important? And not every program talked about self-evaluation as among their key driving forces, but a few did. Some programs, I'm not sure if there are existing strategies for self-evaluation. I'm not sure. I think a lot of us don't think about education in that way. And typically these were programs that had a lot of interest in pedagogy to begin with, right? So how do you teach effectively? And processes that we heard included surveys. So surveys given to trainees about what they could do to improve their training. A few programs use community advisory boards, and these were boards that they would reference, they would share their materials with, they would invite people in to give them feedback on what they were doing. Some programs had sort of keystone advisors, people who were sort of regarded as sort of wise elders in the space that they would turn to and ask for input on. To me, those are the main ways that I have seen sort of self-evaluation discussed in our work.
Great.
And-
Oh, go ahead, Caroline. Yeah.
No, please go ahead.
I was just going to ask a follow-up question on the same topic, but so if you want to add more, please.
Well, I was going to talk a little bit about evaluation from another perspective, which is evaluation of trainees, because that also came up in our discussions. And some programs really emphasize the importance of evaluating trainees throughout the process at various touch points. And one of the challenges that was raised was, what do you do when it seems as though somebody is not able to pass the program or graduate from the program or receive the certificate? And that was a problem that some programs faced. And some of the ways they dealt with that was sometimes suggesting further training after the program rather than giving the certificate, or inviting people to apply again at a later time to go through the training again. So that was evaluation of trainees during the program was also an important component that programs raised.
Great. That actually tied in really well with the follow-up question I had for both of you about evaluation process, but thinking more about how programs are accounting for or preventing harm, both harm happening within the training, but then also of trainees afterwards. I mean, Roman, you opened with how important facilitation is for safety and reducing harm, and I think that's absolutely true. But of course, we all know that there are times where facilitators transgress a boundary or cause harm themselves, and I'm curious if these programs have independent review boards or some way of trying to monitor and reduce harm within and then beyond the program.
Several of the programs talked about the real importance of screening applicants in terms of, screening applicants in terms of like who they were letting into the program, in terms of letting people in who they felt like had a solid sense of self, had some basic ways of being with other human beings that weren't going to be creating harms in the long run. So that was one piece that was strongly emphasized. And then in the actual curriculum or the content of the trainings, people were emphasizing the importance of assessment of participants, so that that there are going to be situations where somebody is not it's not appropriate for somebody to receive a psychedelic compound. And so those were the primary ways that I heard this coming up: screening of participants and also screening of applicants in terms of the application process.
And just it's important to bear in mind that the harms in this case, generally speaking, although we Jack Perna from our team at Emory recently published a case report of harms happening within a psychedelic facilitation program. But generally speaking, the harms are one step removed if they occur, right? So the program is training trainees, and then the trainees go on into the field. So they're, a lot of the time, the potential for your trainees' clients to experience harms is not very accessible to the program, right? And so what we got was really, I think from most programs, a sense of like, how do we set up our trainees to catch harms if they happen and to prevent them if possible. For programs that work specifically with clinical trial teams, they had a very specific, and well-developed vocabulary around harms that I think they just kind of provide as a matter of the training. But I think generally speaking, the scope of the harms tended to correspond with the scope of the program. And that the scope of the harm vocabulary, right? So if a program really teaches to working in a service center, it's not necessarily a priority to also, exhaustively dive into, persisting challenges that might arise a month or two afterwards, because their trainees might not see that happen. At least that's my impression. But all programs described addressing harms as something that was very important.
I'll just add one program said, if we don't do well on this, it not only hurts future participants, but it hurts the field as well. So they took it really seriously.
I have a question about the amount of focus given to Jung, to Groff, and to transpersonal psychology. I'm curious if you're able to, in broad strokes, give a sense of what the theological frame that transpersonal psychology provides, and what, given us a sort of more capacious cert approach, what may be the limitations of the implicit theology of transpersonal psychology?
Wow, that's a dissertation right there. What is the implicit theology of transpersonal? I mean, that's a very rich question. I don't know if I can give a from the hip response to that.
Perhaps I can, maybe an easier way to address it, in the 5 minutes we have remaining, is that transpersonal psychology, you mentioned in the presentation as one of these theological interpretive frames that many of the programs kind of lean into. I'm curious if you see any sort of, what would be the sort of sensible reforms to open up other paths, either alongside transpersonal psychology or to amend what may be the limitations of it, insofar as it's doing theological interpretive work in facilitation?
I mean, maybe I would phrase this because I think, I want to abstain from going in a deep dive about kind of these specific ideas, but rather maybe to frame like what is a theologically capacious approach look like, or a responsive approach, and this is actually something that my colleague Brian McCarthy and I are actively working on, is sort of the need for theological responses in care, and something that we've identified. A lot of the approaches that people without a theological or sort of cert sensibility might think of as just neutral are actually, in fact, theological responses. This is something, when I was a college student, I was really excited about Erich Fromm's ideas about sort of psychology. And I had a mentor who was like, well, you do know there's a theology in there. And I never thought of it that way. And so questions that we might ask ourselves are, what are the claims or the assumptions about things like suffering, which are very theologically relevant, that are being made in this framework? What are the assumptions about truth that are being made, and sort of your capacity to know what is true? What are the assumptions about religious difference and how you navigate religious difference that are being made in this framework, right? And it's just a couple of examples. Also, like, I think really importantly, what are the assumptions about God or the numinous or whatever we call it, right? This sort of like defaulting to a transpersonal process, right? Well, that is a very particular theological response, right? Maybe it's not a transpersonal process. Maybe there really is an entity in the room with you, right? So to ask these questions about our own response, to ask how this relates to the framework that the participant is coming from, and whether we're able to listen for and catch their needs. And also what communities, both for us, the clinician, and for the participants, are not in the room with us, but are we in conversation with, right? As these responses emerge. And I think so you can have a transpersonal response. That might be the response that your client really needed to hear, but to know and to maybe even flag, like, listen, this is making a sort of a little bit of a commitment that we want to be aware of and make sure it's a choice and not just kind of going with the flow.
I know we're very short on time, so you mentioned this, Roman. I mean, I was struck, by the fact that these programs have some ambivalence towards religion, but then we're using, I mean, the MEQ, the mindfulness, things that have a real theological underpinning to them, and so it's interesting to think that and point it out. But the question from the audience that I wanted to get to, because you mentioned non-human, non-physical beings and entities, did that come up in these trainings? I mean, are they training people to engage with spirits or demons or whatnot?
I did not see any explicit framework, again, except for a kind of like cultural humility, cultural competence, and like respond to whatever your participant brings. Be prepared that your participant. I think one program really talked about, there is such a wide variety of psychedelic states. And you really need to be prepared for whatever happens and to really respond to whatever the participant brings, but not like here's what an entity is and here's what they do and here's what an attachment is and all of that kind of. Caroline, did you have a?
Yeah, I would agree with that. I think there was a very small minority where there was maybe a embedded spiritual approach that included that, but I think that was not typical or the norm of the majority of programs that we talked to.
I mean, they did talk about so a couple of programs. When we had our conversations, I see the question, and they named ancestors. So ancestors, I think, is a little bit more something that culturally we have an easier time kind of making legible. And so ancestors were raised as examples of like, well, listen, ancestors might come up but again, just because we were not given an explicit framework doesn't mean that those frameworks were not used. But yeah.
Great. Thank you.
This was truly terrific. Thank you, Roman. Thank you, Caroline, so much for this presentation, for your work on this project. And given the number of questions, there is such interest in this work, and so there will be a lot more to follow for sure. And thanks to everyone who came out on this Tuesday evening to spend it with us. Yes, Roman.
Can I just add, again, Caroline mentioned this, but if you were listening to this and you train facilitators and you heard something and you were like, I think you should really know this, please do reach out to us. And you can find our emails on the Emory website and all of that. But we want to hear from you. We really want to be responsive to what people are experiencing.
And could you two put your emails in the chat while I wrap us up here, so people can just copy and paste them right there.
I don't think we can post for everyone, so I'll put it to host and panelists, and that you guys can call.
Okay, great. Again, yes, thank you on a Tuesday evening for coming out and joining us online here. We're grateful, of course, to the Center's director, Dr. Charles Stang, and the rest of the CSWR staff for their support on this event and the many others we have done this academic year. We're also grateful to the support of the broader Harvard study of psychedelics in society and culture. And as mentioned at the start, we have more programming in the Psychedelics and Spirituality series this semester. As always, you can find all CSWR programming under the News and Events tab on the CSWR website. To name two specifically, on the 7th of May, we'll hold our last walking tour of Harvard psychedelic history for the academic year. The tour will start at 5 p.m. in front of the CSWR at 42 Francis Avenue. We recommend you register ahead of time, as they typically fill up. And on the 12th of May at 5:30 p.m., you can join us for a symposium with two of the CSWR's postdoctoral fellows, where they will present research on sacred plant medicines and indigenous communities of the Americas. The event will be held in person in the CSWR's common room and will also be accessible via live stream in the same Zoom format. And registration is required, and you can find that on the CSWR calendar. And with that, we will bid you all adieu. Thank you for your attention, for your thoughtful questions, and we wish you a lovely rest of your evening or morning or afternoon or whatever time you find yourselves. Thanks so much.
cswr.hds.harvard.edu, copyright 2025, the President and Fellows of Harvard College.